Today we're going to demonstrate proper surgical gowning and gloving. So the first step of this process is making sure that you have the proper attire. So you want to be wearing your surgical scrubs and appropriate footwear. I want to make sure that my scrub tops are tucked into my scrub bottoms. And then I'm wearing a surgical cap and a surgical mask. Now for this demonstration, I'm going to take my mask off so it can be better understood. Also make sure that your cap is over your ears and containing all of your hair. If you have to wear 2 caps to cover all your hair, that's fine. The other thing that I need to do is make sure that I remove all jewelry prior to scrubbing. And then here we have a gown pack and a set of gloves. And this gown pack is wrapped and it's been sterilized, and I know that because it has indicator marks on the tape here telling me that it's been steam autoclaved. So I'm going to open this up. I'm going to carefully open it, and I'm not touching the inside of the pack. And this is wrapped in one layer, and we actually have 2 sets of gowns. We also have a towel on top of each gown, or in this case, 2 towels. Once that's open, I take my gloves, and I'm going to open these up, and I'm going to drop them on this sterile field, like that. Now I'm ready to go scrub. Just got done scrubbing, and normally my gown would be on, but again, I'm taking it off now for clarification. What I do is I'm always keeping my hands below my shoulders and above my waist. I'm going to take a towel on top. I'm going to step away from the table, and I'm going to open up this towel. I'm going to dry one hand, starting at the tips of my fingers, working my way down, drying my hand, down to the elbow. When I get to my elbow, I'm just going to drop it. I'm going to pick up the second towel and do the same thing to my other hand. Now in some packs, you'll only have 1 towel and not 2 towels. So then you have to be resourceful. And the way to do that is to use one end of the towel for one hand and dry your hand off. And then use the other end of the towel to dry your other hand off. So that's if you have 1 towel. Just drop it. Here's what you don't want to do. You don't want to put this down. You don't want to do this. Keep your hands below your shoulder and above your waist. Also, make sure that your hands are dry. Trying to put rubber gloves on with wet hands is really difficult. Once my hands are dry, I'm going to grasp the gown, and the part of the gown that's facing me is the part that's going to be going up against my body and therefore will not remain sterile. So I pick this up and I make sure I got a good hold of it and it's clearing the table, and I bring it away from the table. Here's what I don't want to do. I don't want to pick up this part and drag it off like that. Okay? Now these are folded up so that when you grab it, you can hold the very top part near the neckline, right there. You can see the neckline. And the bottom part falls down. And now what I do is I open this up, and it should become obvious where the armholes are once it's unfolded. There's one, there's the other. So I'm going to hold this with one hand. I'm going to put my arm in the one armhole like this. I'm then going to fold my arm and support the gown like this. And I'm going to find the other armhole with my other arm. Okay. My hands are underneath. Have an assistant help you put the gown on. and they'll tie some ties in the back. I want to make sure that my hands do not extend beyond the cuffs of the gown at this point. It might make it a little bit tight, but it can be tied rather loose in the back, and after I put my gloves on, the back can be tightened. Now, I need to put my gloves on without having my hands extend beyond the cuffs. So I'm going to open up my glove pack. I'm taking the left-hand glove. I'm going to flip it over so the thumb is against my forearm, and the cuff is up against the cuff of my gown. I'm then going to pinch the cuff of the glove through the cuff of my gown. With my other hand, pinch the cuff of the glove through the cuff of my gown, and I'm creating a little opening there. What I do now is I'm going to stretch this over the opening of my left sleeve, like that. I can then take the edge of my glove and bring it down, like that. So now the entire cuff of my gown is covered. As you can see, only a small part of my fingers are extended through the cuff. What I can do at this point is actually pull on the sleeve of my gown, stretch my fingers to get my fingers into the fingers of the glove. So I can pull on the glove, I can pull on the sleeve, get it until it's positioned about right. The white cuff part of the sleeve should always be within the glove. Now I'm going to repeat the same procedure on the other side. It's a little bit easier because I have this hand free. Again, I'm going to pinch the cuff of my glove on both sides, create an opening, and pull it over like that. Okay, we're all gloved in. And now, to complete the gowning process, I need to tie the rest of my gown in. This is a back tie or a sterile back gown. And so what I'm going to do is I'm going to untie these two ties in the front. This tie is attached to the front of my gown. This tie is attached to this back panel. So what I need to do is hand this tie to somebody who is sterile. So we're going to pretend that Kari is sterile. So come on in, Kari. She's going to hold that, and then I'm going to spin around like this. I'm going to take it, and I'm going to tie it. So you're best off if you do the tie-in once your assistant is already tied in and has gloves on. So then you can tie each other in. So that completes the gowning process.